Today I'm going to talk about foods and drinks that actually increase blood flow to your legs. And the reason that we need to talk about this is because if we don't have good blood flow to our legs and our feet, we wind up actually having serious problems with walking. And it actually even gets worse if we don't have enough good blood flow to our feet. Actually, our skin will actually open up and we'll actually have wounds that can actually not heal, become infected, get gangrenous, and it can lead to amputation. So I'm a medical doctor. I can tell you that I work in this space, vascular space of blood flow. And one of the things that we really focus on is making sure that all of our organs and all of our tissues, including the bones and muscles and skin of our legs, actually have good blood flow. Okay, so think about what causes poor blood flow into your legs. Well, if you have narrowing of the arteries, atherosclerosis due to high blood cholesterol, high lipids, if you actually have hypertension, high blood pressure, hardening of the arteries that comes from smoking and vaping, damaged blood vessels from conditions like diabetes, all of these things can actually compromise blood flow to your leg. Now, think about it this way. Your heart is the source of pumping blood for the rest of your body, including your legs and your feet. If you want blood flow down to your big toe, your heart's got to be working really well to pump that blood. So cardiovascular health, having good heart health, is the beginning of actually having good circulation to your legs and, frankly, anywhere else in your body. Things that actually help protect your heart. Cardiovascular health is number one if you want to actually have good blood flow. If you have problems with your heart, baggy heart, heart failure, cardiomyopathy, you're not going to actually have good blood flow to your legs and feet. And that actually has really, really bad consequences. So number one, having good heart leads to good blood flow. Having healthy blood vessels is really important. And also having really good nerves to your feet are also important as well. A lot of people don't realize this, but if you think about it, the nerves on the bottom of our feet are absolutely critical for health. What do I mean? Well, if you've ever walked on a beach and had your sand, the feeling of your toes in the sand, that feels nice, right? It reminds us of our childhood, it reminds us of our summer vacation. Well, there are people who don't have sensation on their feet. People who have diabetes, for example, it's a condition called neuropathy. They can't feel the sensations of their feet. So look, sand is a nice sensation, but if they step on a shard of glass or a nail, whether it's rusty or not, it can actually cut the skin, and now they don't actually have sensation. They won't feel that ouch. They won't pull back, and that cut will actually be there. They won't even know it's there because it doesn't hurt. There's no pain. And because it's on your feet and your feet are walking on the ground in shoes, it's very easy to get infected. And that infection can set into motion a chain reaction that you don't want to have. All right. And if you have diabetes and you actually have lower immune system, that infection can actually crawl up into your skin and in tissues and break it all down. That's called diabetic neuropathy, where you can't feel, and leads to diabetic foot ulcers, which is actually where you actually have a hole in your foot. Now, my work in angiogenesis, blood vessels, genesis, how your body grows blood vessels, is all about healing. And not only have I been involved with the biotech side of actually helping to grow new blood vessels, improve circulation, but my work in food is medicine, actually taking a look at what are some of the foods that we can eat to actually help support good circulation as well. So I want to talk about a condition called peripheral arterial disease, because this is actually a condition that really exemplifies, it shows you just how bad it can be if you don't have good blood flow. So peripheral arterial disease, or PAD, is really narrowing of the blood vessels into your legs and narrowing and hardening of the blood vessels to your legs, where you're actually not getting enough blood flow. Now, how do you know you're not getting enough blood flow? Well, listen, our legs are full of muscles, and when we're walking, we're contracting our muscles. Look, if you're walking to the parking lot from the grocery store, you need those muscles working. And if there's not enough blood flow to those muscles, you're going to be able to get to a certain point and then the muscles are going to cramp up. They just don't have what it takes to actually keep working and moving. The lactic acid will build up, and then you'll have to stop for a while, rest, let the work stop, and whatever blood flow you can get begin again until you're clearing that lactic acid and the blood flow is actually getting enough oxygen. Then you can walk again for a little bit. When I went to medical school, we used to, talk about this idea of the person with bad circulation being able to walk in a shopping mall. Now, I know most shopping malls don't exist anymore, but it was sort of walking 100 feet from one store to the other store, then having to sit on a bench to rest before they can get up and go again. So when you have intermittently leg pain because you don't have good blood flow, that's called intermittent claudication. And that's when basically you're narrowing your blood vessels down in your legs. Now, if you actually have blockage of those blood vessels where even at rest, you're not getting more than a trickle of blood, then that can actually go into a crisis situation. It's kind of like a heart attack of your leg. You know how a heart attack is where you have a blockage of a blood vessel and you're suddenly having a crisis in your heart. Not enough oxygen being delivered through the blood vessels in your heart to your heart tissue. What happens? You get a heart attack. Heart tissue dies, you might die. Well, in the leg, when you actually have a heart attack of the leg, you wind up actually having critical limb ischemia. Limb is leg. Ischemia means it's a situation where you just cut off the blood flow, all right? You strangulate the muscles, and now it hurts all the time. And when you have critical limb ischemia, you're not getting enough oxygen, and just like in diabetes, you can actually have skin breakdown. In this case, skin breakdown because you don't have a blood flow, and that can get infected, and now you can't, until you fix the blood flow, basically tissue starts to die. You get gangrene, and then you can get infected and require an amputation, all right? So I want to set the stage. This is why I'm talking about this topic. I'm a vascular doctor. I study blood vessels. I know a lot about what it takes actually to improve blood vessels. You could have surgery and bypass. You can have stents to open up the blockages. But one of the things that you can actually do is to have lifestyle changes that can make a big difference. You don't want to be going to the surgeon all the time. And actually, the surgeons don't want to have to operate until you actually need to have surgery for bypass or a stent, for example. So what are some of the things you can do from a lifestyle perspective that I can share with you that be helpful? Let's first, in this particular case, talk about the things you can cut down or cut out. All right, now I'm somebody who's really positive. I like to say what you should add, and I'm going to tell you the foods that you can add to help improve and support your circulation to your legs and feet. But I do think that in this particular instance, let's start by thinking about the things you want to cut out. You want to cut down or cut out alcohol. Alcohol is a toxin. Alcohol is hard on the blood vessels. Alcohol stuns your stem cells that are needed to be able to rebuild blood vessels. And so when you drink a lot, you actually make it harder for your legs to maintain their circulation, particularly if blockages. That alcohol just kind of rips the rug away and makes it much more difficult to actually repair and maintain that circulation, number one. Number two, you don't want to eat too much salt. And we tend to eat too much salt in society. If you go to a restaurant and see how into an open kitchen, you see how the chef throws salt into the food. Salt tastes great, but guess what? Salt is really, really hard on our blood vessels. If you want an analogy, it's kind of corrosive to our blood vessels. You know, salt on the road, how tough it is on a road surface. And so after a tough winter with a lot of salt on a road, you get potholes. Well, that's basically what happens when you have too much salt in your bloodstream. You wind up accumulating a lot of fluid, you get hypertension, and then the lining of the blood vessel gets damaged by the high salt environment. When the lining gets damaged, the lining starts to be more sticky, and when cells stick to the lining and lipids, fat, cholesterol sticks to the kind of like corroded surface of the blood vessel, guess what? Blood vessel narrows. When blood vessels narrow, you get less circulation. So don't eat too much salt. Cut down or cut out salt. Get the low sodium version. And avoid ultra-processed foods. Now, we know ultra-processed foods is connected to so many chronic diseases, but the one that I really want to talk about is atherosclerosis, right? So you wind up actually having more lipids, more narrowing of the blood vessels, too much salt, which, as I said just now, corrodes the inside of your blood vessels, and ultra-processed foods sets up for type 2 diabetes, metabolic syndrome, and type 2 diabetes. And diabetes is a condition that's well known to damage your circulation, all right? And the damage from type 2 diabetes, for example, when it happens in the eye, you wind up actually having diabetic retinopathy. Blood vessel damage due to diabetes in the eye leads to blindness. Blood vessel damage due to diabetes in your legs lead to poor circulation and can lead to wounds that are opening up, because in diabetes, you wind up having neuropathy, and then you having a vasculopathy, meaning not only can't you feel the sand in your feet or the nail or the thumbtack, you also can't grow the blood vessels that are necessary, and you don't have enough blood flow. So everything, all the tissue starts to die, and your immune system can't clean up the infection, and then you wind up actually getting gangrene. So these are like serious life and death reasons. And I know, look, we're talking about, this is my YouTube channel is really about health and wellness, but because I'm a doctor, I can talk about these like serious conditions, and many people suffer from peripheral arterial disease, all right, or diabetes and peripheral arterial disease that can actually affect circulation to your legs. So this is a more serious video. I'm talking about this. Now, another thing to cut down or cut out, you should stop smoking, stop vaping, because the nicotine actually damages your blood vessels, makes it harder, and it increases atherosclerosis. And vaping actually is even worse, all right? So smoking cigarettes, cigars, pipes, vaping, no, don't do it. Actually, it's bad for your leg circulation. And if you're somebody who is, let's say, in their middle age or older, and you already have bad circulation, you smoke and you vape, you're making everything an order of magnitude worse. Now, the other thing you want to do is you want to check your blood lipids, because you want to keep your blood cholesterol under control. Cholesterol, blood lipids, are what sticks to the side and narrows up your blood vessels. So if you want good leg circulation, you need to get your blood lipids under control. Blood lipids are measured by your doctor when you get a checkup, an annual checkup. You should get your blood lipid panel checked. And the classic thing to do is actually to give you statins if you have high blood lipids. They may actually be warranted, all right? But you need to actually watch your diet, cut down on saturated fat, and also exercise. And there are diet and lifestyle ways to actually improve your blood lipids. Now, your gut health is also responsible, your gut bacteria health, your microbiome is responsible for lowering your blood lipids as well. So if you want to stay off of statins, the one thing you want to do is actually improve your gut health. Even if you're on a statin, you should still improve your gut health, because your gut bacteria will help your body make it easier to lower your blood lipids and actually improve your circulation. Research I've done has shown that good, healthy gut bacteria can actually help heal your blood vessels and heal wounds as well, improve circulation. We found that one bacteria called Lactobacillus reuteri, which is part of a healthy gut bacteria, we did lab research and showed that if you actually give experimental animals Lactobacillus reuteri, you can actually speed up wound healing, improve circulation, decrease inflammation. These are all really important things if you have compromised blood flow in your legs. So I'll tell you, you can actually get Lactobacillus reuteri in different foods as well as sourdough bread, Parmigiano Reggiano cheese, although you don't want to have too much cheese. It's very salty, which is not good for leg circulation, and it's got a lot of saturated fat, which is also not good. But sourdough bread, that's a good source, not too much, all right? And you can actually get a dietary supplement for Lactobacillus reuteri as well. So what else can you actually do to actually improve gut health? Well, I'm going to tell you some of the foods that actually can improve your gut health and also improve your circulation. So let's talk about 5 of them. Food number 1, beans. Now, my good friend Dan Buettner, who is the pioneer of the blue zones, has told me that all of the healthy cultures in the blue zones, their common denominator of health are eating beans and legumes. Beans are a good source of dietary fiber. They've got healthy fats in them. And it turns out that beans improve your metabolism by burning down harmful body fat. and that lowers inflammation. And by shrinking harmful fat, burning down harmful fat, we're actually unloading our circulation as well. When you've got a lot of fat, your blood's got to pump out against basically a wall of fat, blood through a wall of fat. So decreasing excess body fat, visceral fat, is actually a good thing. Decreasing inflammation is good for your blood vessels, less damage to the lining of the blood vessels, and better metabolism steers you away from type 2 diabetes, and diabetes sets up for circulatory problems, the way I said. So eat beans. All kinds of beans are good. I love navy beans, but black beans, kidney beans, and also other legumes like lentils and chickpeas are also really good. They're good for good general health. They activate your body's health defenses. They activate your metabolism, but they're also good to help support all the things that you need for better leg circulation and to avoid the problems that can actually cause severe peripheral arterial disease that progresses to intermittent claudication. That's pain every now and then when you're walking, and then pain all the time because you've got critical limb ischemia. So beans. Number 2, carrots. Carrots contain carotenoids, okay? And studies in the Netherlands are showing foods eating carotenoids like carrots can lower excess body fat, burn away the extra visceral fat, which lowers inflammation, and that can actually unburden your circulation, making blood flow a little bit better. Now, carrots are also a good source of dietary fiber. Feeding your gut bacteria this fiber allows them to lower and streamline your metabolism of your lipids, which then makes it less likely you'll have a blockage. You see how this works? Good gut health, dietary fiber, better lipid management. Also, lowering inflammation is absolutely critical. And that's what researchers in the Netherlands found, is that eating foods with carotenoids like carrots lowers inflammatory markers in the bloodstream. That actually is super important because that lining of the blood vessels that you want to keep nice and slippery smooth. You don't want to have it roughed up. Remember I told you high salt roughs it up. Smoking roughs up the lining of your blood vessels. Well, actually eating carrots containing carotenoids helps to protect the lining of the blood vessels as well. Number 3, garlic. Garlic is, not only a great culinary tool. I love to chop up garlic, saute in a little extra virgin olive oil, and no matter what you put in there, whether it's a vegetable, whether it's a seafood, whether it's a meat, I can tell you it actually makes the food taste a lot better. Think about Mediterranean cuisine, the healthy Mediterranean cuisine, but also Asia. Asian cuisine also uses garlic abundantly in order to be able to create healthy and cook healthy food. So you have extra virgin olive oil, garlic, and you've got vegetables. You've got the makings for a good Mediterranean vegetable dish. And what garlic does, it's amazing. It's good for leg circulation. Garlic's been shown to lower blood lipids, all right? So lower blood cholesterol, lower the bad cholesterol, the LDL, maintain good or even raise good HDL cholesterol. And that's important to actually protect the blood vessels that you don't want to have narrowed into your legs and your feet. Now, garlic does another thing, which is really important to prevent these sort of heart attacks of the leg. Garlic prevents blood from clotting, all right? So it's anticoagulant. And remember I told you, the heart attack of the leg is where basically you have blood clots, a narrowing in blood clots that can actually form on the roughed up lining of your leg blood vessels. And now you have a heart attack of the leg. And garlic actually keeps the blood flowing, all right? It interferes with platelet function, garlic does. And so when platelets are necessary to create a clot, it keeps the traffic moving. It's kind of like a policeman near an area that has some road work, and the policeman, like garlic, is basically telling traffic, keep going, keep going, keep going, one at a time. And that's basically what garlic actually does to prevent blood from actually clotting, all right? Food number 4, dark chocolate. Now, dark chocolate itself is a candy. It's a confection. But dark chocolate is a candy made with high amounts of plant-based material called cacao. Cacao is actually what you use to make chocolate. So dark chocolate has more cacao. You've heard about this, 70%, 80%, 90%, even 100% cacao. It comes from a seed pod that grow in tropical areas. And that seed pod, when you take out the seeds and you dry them, ferment them, crush them, is actually the basis for making chocolate. The more cacao there is, the darker the chocolate. Because it's plant-based, researchers have found that cacao actually contains polyphenols. In fact, these polyphenols are called flavonoids or cocoa flavonoids. We know what some of them are, like proanthocyanidins and anthocyanins. These bioactives have been shown to be very, very important for blood vessel health. Number one, they lower inflammation. Anything that lower inflammation is actually good for the lining of the blood vessels, all right? They also lower the risk of blood clots. They improve overall circulation, and the proanthocyanidins from dark chocolate actually can help stimulate the body to produce nitric oxide. Nitric oxide is actually a gas, but it's more of a signal inside the body that actually recruits stem cells. So dark chocolate recruits stem cells into our bloodstream. By the way, we're all formed of stem cells. When you were in your mom's womb, before you were human looking, you were just a ball of cells, and it's stem cells that form that ball. And the stem cells could become anything. And that's how you develop the face. That's how you develop arms and legs and a heart, a kidney, and toenails. All right, they all came from stem cells. And so when we're born, we've got extra stem cells. It's kind of like I have an extra can of paint after you finish painting a room. And just like when you have extra paint, you put the cap on, you put it in your basement in case you need to do touch up. In our body, our stem cells after we're born, we've got excess. Those are packed up and they're kept in our bone marrow and other places as well. But the bone marrow contains a lot of stem cells. And dark chocolate actually recruits stem cells out of our bone marrow like bees flying out of a hive. And those stem cells go around looking for anything that needs to be repaired in our circulation, including in our leg and our feet. All right, so dark chocolate helps to improve circulation in our extremities, including our arms and our legs and our feet, and improves blood flow. And this has actually been shown in research that's been done looking at people in their 60s with known heart disease, and they've got blood vessels to begin with, and they did a test called flow-mediated dilation, where they actually put a blood pressure cuff on the arm, blow it up, hold it there, cut off the blood flow to the arm, okay, and then they suddenly let it go, and they use an ultrasound to measure how well the blood vessels rebound when their blood flow is returned. That is called flow-mediated dilation. It's a measure of vascular health. Okay, why is that important? Well, it's important because when in a clinical study, they took men who were in their 60s with known heart disease, they gave them just the equivalent of 2 cups of hot chocolate made with dark chocolate. Over 30 days, they actually found that stem cells came out into their bloodstream, more stem cells came into the bloodstream. They could measure them in each patient, more over 30 days. And then when they measured flow-mediated dilation to see how resilient, how normal functioning the blood vessels are, they found that the dark chocolate hot cocoa intervention actually improved blood flow, improved blood vessel resilience, improved circulation. All right, and that was in the upper extremity, but the same thing would actually happen in your legs as well. So that's food number 4. Food number 5, black tea. You know, Earl Grey, English breakfast tea. There's a lot of black teas that are out there. Fermented teas are also black. Now, black teas are actually start out as green tea, and then they're actually oxidized until they turn black. And then they can actually be fermented as well. Now, black tea contains the same polyphenols, catechins, as green tea does. Maybe a little bit less because of the oxidation, but it's still there. And it turns out that same way the green tea is useful because of these catechins and polyphenols, black tea is also useful. And studies have been done in Italy of black tea and the impact of black tea on stem cells and vascular health. So they took older people who had definitely bad circulation and gave them black tea, 2 cups to drink for a day for a month. And they actually measured in their blood their stem cells. And what they found is that black tea would actually cause stem cells to come flying out into their circulation. These are stem cells normally found in the bone marrow that would actually repair the circulation and improve circulation. Now, how do they know this? Because they did flow-mediated dilation. They did that blood pressure test to see how well the blood vessels would rebound. And from compared to before black tea and then till after a month of black tea, they saw tremendous improvement. Now, here's what they also did, these researchers. They added whipped cream into the black tea to see what would actually happen. All right, and guess what? The whipped cream, the high dairy, remember, I've made other videos to actually tell you this. Dairy in milk or coffee will form little soap bubbles, and those soap bubbles trap the good stuff. They trap the polyphenols. So in the case of black tea, little dairy fat soap bubbles trap the catechins, the polyphenols. So when you drink the black tea, those soap bubbles roll down your gut, and you're not absorbing as much of the polyphenols. All right, you absorb some, but not as much. And that's exactly what they found when they had black tea and they added whipped cream to it. Probably tasted pretty good, honestly. It actually lowered the amount of stem cells that came out. Stem cells didn't come out quite as frequently. All right, and so that shows you you're not getting as many polyphenols, and that's one of the reasons why you don't want to use dairy milk in tea or coffee. Same thing will happen with coffee. Nut milk is fine. Oat milk is fine. Soy milk is actually fine. Just don't use dairy milk.
Hey, just a real quick one here. If you're enjoying this video, then you'll definitely want to check out my free recipe for a carrot top salad. That's right, I said carrot top. In the video, you've already learned that carrots are a great source of carotenoids and dietary fiber. So now I want to show you how to enjoy this delicious vegetable from root through stem. And guess what? It only takes 15 minutes to make it. Get the full recipe. It's completely free right now in the caption below. Now, back to the video.
All right. Now, there are some other foods that can actually help support your stem cells, which are required for improving your blood vessels as well. I'll give you some foods that can do this for stem cells. Barley. I love barley soup, for example. You can put barley in a stew. Barley contains a bioactive called beta-D-glucan. Now, this is a soluble fiber. It's a bioactive. And the fiber improves the gut microbiome. The gut microbiome lowers inflammation. The gut microbiome also improves blood lipids, so it lowers the risk of having blockages in the circulation. And the beta-D-glucan actually directly helps to grow new blood vessels as well. It causes angiogenesis, which is what I study, so that's why I know about this. Okay, so barley is one of the foods that can do this. Another food that actually has beta-glucan are mushrooms. Now, I love mushrooms. Not everybody loves mushrooms, but I love mushrooms, and I know a lot of other people who love mushrooms. The lowly white button mushroom filled with beta-glucan. All right, but then there's other mushrooms that also have it as well. Chanterelle, shiitake, enoki mushrooms, portobello mushrooms, porcini mushrooms, you name it, oyster mushrooms. Mushrooms have beta-D-glucan. And by the way, where is the beta-D-glucan found? It's in the cap of the mushroom, which is the part that we normally cook with, right? But there's beta-D-glucan is also found in the stem of the mushroom, which when I used to buy mushrooms years ago, I used to come home, take them home, clean them up, and cut off the stem. I used to throw the stem away. But guess what? The stem has twice as much beta-D-glucan. So save the stems, eat the stems, make the stems into a food, or saute the stems into a soup, or saute the stems if you actually like it. All right. Now, I love to cook mushrooms, slicing them up. A little bit of extra virgin olive oil. You can chop up some shallots, a little bit of garlic, add a little bit of thyme in there, and literally just quickly saute the mushrooms. You don't need a lot of oil and you don't need a lot of cooking time. And just within literally a minute or so, you'll actually have perfectly cooked mushrooms. If you slice them thin, they cook a little bit faster. And that's really one of the lovely things that you can actually do with different kinds of mushrooms. You know, chanterelle mushrooms sauteed that way are really amazing. Porcini mushroom is sort of a delicacy in the Mediterranean. Italians love porcini mushrooms. I loved it. I learned about porcini mushrooms, by the way, when I was doing a gap year in Italy. And the friends that I was staying with would introduce them to me. And I'm like, what's the big deal about mushrooms? You know, they're like, oh, it's a really big deal. And when I tasted it, it was amazing. It was like a steak, you know, like it's sort of like the T-bone steak, the ribeye of mushrooms are porcini mushrooms. Now, I talked about barley, I talked about mushrooms. Hey, what about making a mushroom barley soup? Man, that is a combo that actually is good for your circulation by being good for your stem cells, by being good for your gut microbiome. So think about that. A barley soup, or make a stew with barley and mushrooms as well. Now, here's another food that actually is really good for your circulation, and that's dried fruit. Fruits with peel, all right? It turns out that fruit peel contains something called ursolic acid, and lab studies have showed that eating ursolic acid or feeding lab animals with ursolic acid improves circulation. In fact, there are lab animal models for peripheral arterial disease, the very condition I'm talking about. Bad circulation to the feet. You can get gangrene and wounds to the feet. Guess what? Lab animals eating eating fruit peel, extracts made from fruit peel containing ursolic acid, the circulation is restored. You can actually get reperfusion, better blood vessel growth if you actually are having fruit peel. Now, how to get fruit peel? You can eat fruits like apples, pears, peaches, all have fruit peel, right? So here's how the peel is good for you. But you can also have fruit peel if you get dried fruits as well, right? That's an easier way. If I told you can have apricot peel is actually good for you, you might eat one apricot, maybe, or two if I really pushed you on it. But guess what? If you had dried apricots, you could eat 6 of them pretty easily. Now, you got to be careful eating a lot of dried fruit because it's got the sugar from the fruit as well, and you don't want to have too much sugar in your body. So I just mentioned 6 dried apricots. That's got sugar from 6 dried apricots. If you're trying to avoid diabetes and metabolic syndrome, you probably don't want too much, but it is a way of actually getting the peel, okay, in a smaller, shrunk down, kind of the shrunken head version of fruit peel or ursolic acid. And speaking about fruit peel, this is one of the times that you probably want to buy organic. Because again, I can tell you that studies have shown that if you're using pesticides on fruits, that the pesticide isn't just stuck to the outside that you can rinse off, but you can actually penetrate about 20% of the skin using the pesticides, and that you can't wash out. And yet you want to eat that fruit peel. So this is an example of where organic probably pays off if you want to get the benefits of the ursolic acid from the fruit peel, okay? Now, the other thing I would tell you that is another little bonus food that actually be good for your blood vessels and your stem cells are foods containing omega-3 fatty acids like seafood. Omega-3s in the bloodstream protect your stem cells. All right, and you need your stem cells in good shape. It's kind of like the bulletproof vest or the security detail for your stem cells. Omega-3 makes sure that the stem cells are accompanied to their destination and are in good shape. Best sorts of omega-3s, you can have a supplement made with omega-3s, but you can get into seafood as well. Just don't eat too high on the food chain, because then the big fish contain also heavy metals like mercury in their flesh. But if you eat lower in the food chain, you'll be just fine. Like salmon. Salmon's a great source of omega-3s. I would actually get wild-caught salmon rather than farm salmon, because farm salmon are fed chicken and sometimes pellets that contain omega-3s. So get wild-caught salmon. It's going to be better for you. And they're actually eating the foods and the plankton and stuff like that that actually has the original source, the OG source for the omega-3s. But it's not just salmon that's good. Cod actually is also good as well. And cod, you need eat about 2 playing card decks worth of cod to be able to get the same amount of omega-3s that you get in 1 card deck size serving of salmon. But that's easy to do. That's not very big. Other sources of seafood also have omega-3s. For example, clams and mussels and shrimp. Lobster also has omega-3s. Squid and octopus also have omega-3s if you're eating seafood. So what's wonderful is that you can actually find all kinds of sources of omega-3 fatty acids that can help protect your stem cells. Now, I'll give you a couple of other tips that would be really helpful. If you want to actually cook healthy foods in ways that are not going to hurt your stem cells, you don't want to be frying your foods, all right? Seafood that's fried, no good. Vegetables that are fried, even like tempura, like I like the Crispies, don't do that, because frying actually creates harmful chemicals like carcinogens that actually provoke inflammation in the body. And you don't want inflammation to damage the lining of your blood vessels. That's not good. all right, especially if you have peripheral arterial disease. So you don't want to be eating fried foods, all right? That's a really important kind of concept. Now, there's all kinds of other dimensions of peripheral arterial disease and diabetes and the conditions of together that I can talk about. I'll make a separate video about wound healing and wound care about that. I've spent a lot of time working in that space, and some of the dietary and foodist medicine approaches that can be helpful as well. But now you've got sort of a big walk around the park of peripheral arterial disease and dietary do's and dietary don'ts and some lifestyle don'ts in terms of how to actually maintain good blood flow to your legs and feet, even if you have peripheral arterial disease. But if you want to avoid it, these are also tips that also can work. So hopefully you learned something about your circulation in your leg. Thanks for watching, and I'll catch you on the next video.
Hi there. If you enjoyed watching this video, I know you'll love the next one. Stay here and check it out, and I'll see you there.